So the framework will really help integrated care systems to really focus on listening to people that they don't always hear from, and it allows real collaboration and partnership working with people and communities.
Before I joined National Voices as a member of the team, I was working alongside National Voices as a lived experience partner, and I was invited to co-chair the expert advisory group on the framework project. It was important for National Voices that somebody with lived experience was co-chairing alongside our Chief Executive, Jacob, to make sure that the voice of lived experience was woven throughout the co-design and kind of in an advisory role across the project.
Health inequalities are growing wider and wider, and I think there is a real concern about a wide range of inequalities that are just not being addressed.
People who experience health inequalities are often left out of conversations around health inequalities and improvements that can be made. And people with lived experience are experts in their own lives, their health conditions, and the lives of their communities as well.
I got involved through National Voices as a lived experience partner alongside my colleague Marcia. We both bring real experience around the experiencing of health inequalities, and we're really excited to get involved in developing a framework.
The framework is designed to be used really flexibly so that it can be used at different levels within an ICS and with a range of different communities and populations within an integrated care system.
For the first time, I'm seeing something concrete being developed. There's a lot of talk about health inequalities, but not as much action as I'd like to see. This gives us an opportunity to get on and do something.
My first hope for the framework is that it is seen as an improvement tool and not an assessment tool. It is designed to help ICSs think about how they can take the next step in improving their practices and the impact of their engagement with people and communities.
It's a really, really helpful tool to help them really drill down into the what matters to communities rather than what the systems think matters to the communities.
It is usable, we hope, at every level of an integrated care system, and also designed to be used with people and communities within an integrated care system so that the framework can be used collaboratively and can improve relationships, both in assessing previous engagement projects and planning for future ones.
Obviously, there are no guarantees. This is a framework. It is being piloted. The proof of the pudding is when it's rolled out. It is not a mandatory tool for ICSs to use, but the hope is that because the pilot sites have really welcomed this and have reflected how well they can use it in different situations, that nationally it is picked up and used as both a retrospective tool but also a forward-thinking tool to hopefully really address these inequalities and help reduce them where they can.
Success for me would look like ICS is kind of adopting the framework and running with it, using it to proactively improve their processes, improving the relationships with the people and communities that they serve, becoming more aware of the health inequalities within the communities that they serve, and enabling people with lived experience to have more influence in the decision making within an integrated care system.
For me, the framework really does harness the power of making an actionable difference in people's lives.